Hi, welcome back. I am Paul Chartier. These two gentlemen are with the Kentucky Cancer Foundation, a sort of new foundation in Kentucky that they can explain, but it's long overdue. Jack Hillard, Dr. Whitney Jones, thank you.
Thank you.
Thanks, Paul.
Twins, you look great. Jack, tell people what this foundation's all about and why it got started.
Well, Kentucky has a cancer problem. We just have simply too much cancer incidence and unfortunately mortality in Kentucky. 25,000 new cases every year, and unfortunately half of those folks won't make it to a second year. I'm a cancer survivor, very fortunate, but I'm a survivor because it was caught early, and it was caught through early screening, early detection. But even with that, in my cancer, colon cancer, it didn't need to happen or go further. Early screening helped save lives. And so we realized that the federal government does a plan in every state known as a Cancer Action Plan. And one had been in development in Kentucky for 10 years, but there wasn't funding for it. And so we created a private nonprofit to help put into action what we believe, and when I say we, it is 55 nonprofits that have come together to say, let's work on this to reduce cancer in Kentucky.
Yes, we do have a big cancer problem, and thank goodness for you and your vision to spearhead this, start it, get it off the ground, build this momentum, and where is it right now?
Well, first of all, I feel lucky to be part of a team, and really I'm just the person who's able to get out. But I think where we are now is that we've interestingly started with colon cancer as part of the Kentucky Cancer Foundation in terms of funding a match. We had a huge problem in colon cancer. We were the worst in the nation for screening. Therefore, we ended up being the worst in the nation for the number of cases and the number of people dying for it. So through a 10-year process with a lot of partners, we've doubled our screening rates. We have decreased mortality rates by 28%. That turns out to be about 150, 170 people a year who aren't dying from it, and almost 400 people who aren't getting it with a 25% reduction. But that didn't extend to the uninsured. It didn't extend to those people who were underinsured. So we had a real disparity there. And really what the foundation did was help with the Kentucky Colon Cancer Screening Program, which was passed into law in 2008, but never funded. But when we were, well, but that was the middle of the recession. It was a very tight time. You know, it was a time for fiscal belt tightening. So, but we did a lot of work despite the fact that it wasn't funded because we did a lot of outreach and education. But in 2012, we were kind enough to be able to make a pitch to Governor Beshear to say that we would create a foundation that would develop matching funds to help start a statewide colon cancer screening program to help the uninsured. First of its kind of its nation in terms of a public-private partnership, and one of very few states to actually fund its Cancer Action Plan. And I can tell you in 2014 that program is now statewide, and people are shaking their heads around America saying, what the heck's going on in Kentucky?
We're a leader in something besides basketball? This is great.
Well, we have a lot of challenges remaining, and the program's working great, but we're screening, you know, probably we'll hit 2,000 this year. And when we look at the numbers for that, we've probably saved the state's population over $11 million in downstream treatment from cancers that would have developed had they not been either detected early, through early detection, so less cost on treatment, or through prevention through removal and identification of polyps.
So what a great public-private partnership. The legislature and the governor, state government, put up $1 million for the initial phase. We agreed to match that dollar for dollar. And so public and private, a $2 million investment, and as Dr. Jones said, a savings of $11 million just in our first initial effort.
You're saving money, but aren't you saving lives too?
Exactly. Whatever side of the argument you're on, we're with you. But it really couldn't have happened without the legislature, and that's both the Republicans and the Democrats. We know almost all the folks in the legislature whose cancer's affected them or their family, and they're passionate about this because what they really like seeing is this is Kentucky money going to help Kentucky citizens in an organization, in a structure that was built here for us. And that's what really, I think, distinguishes us from a lot of the other cancer organizations, because a lot of people would say, well, why another cancer organization? And I would suggest that we have a unique approach, we have extremely good results, and we're not done.
The two parts of cancer: prevention, treatment. Do you educate on both sides? Are you working on both sides, or just on the?
Well, I think the continuum of cancer really, you know, we can't forget about treatment, and but we really think other people have that ball. You know, that's where the hospitals come in. That's where the networks, the physicians, the Department of Public Health, you know, all of the major health networks in the state of Kentucky have been proud sponsors of what we've done, because they know that if we can do prevention or early detection, that the folks walking into their hospitals aren't going to be walking in with stage 3 and stage 4 colon cancer. We've flipped the ratio completely in our state, but if we don't do it for all of our neighbors, particularly the ones who are and underinsured, I don't think we've completed the plan.
Well, and that's why the sponsors on the private side have been the providers and the hospitals providing that care. University of Kentucky, Kentucky One, Baptist Health Systems, Norton Health Systems, even the new insurers to the game of Passport Health. Those have been, but also private donors. Famous Kentuckian Diane Sawyer stepped up with a very considerable gift to this. So this truly public-private partnership. And when Dr. Jones mentioned the legislature and their interest, well, let's face it, they or their families have nearly all been affected, because for our 4 million Kentucky family, all of our families have been touched in one way or the other.
You said you've affected about 2,000 people. What's your goal? What's your vision?
Well, when we first started off in 2012, we had 10 sites across the country, across the state. What we've done is expand that to 15 sites, and now those people who don't have screening programs within their county can access some of these other counties that have. So our goal is actually to build, develop, fund, and run the nation's best colon cancer screening program for those who are underinsured. And really, given the Medicaid expansion, it's a really new opportunity, because many of the people who were uninsured are now insured, but through reaching out through them, assessing their need for colon cancer screening, we can assess their need for potentially being covered with the Medicaid expansion. So our goal is that no Kentuckian goes without proven and evidence-based cancer prevention.
People can be stubborn. They don't want to go to the doctor. Imagine that. Even as nice as well-dressed as they are, they don't want to go to the doctor. How do you educate them? How do you get them the mindset to go through your screening?
Well, I think that in Kentucky, and I'm going to borrow this from one of our board members, Crit Llewellyn, because she eloquently speaks about this. In our parents' generation, cancer was a death sentence. And so looking for cancer, trying to find it, had no real validity, because once you did, you were in, and you were still going to go.
Yeah.
But that is not the way it is right now. So I think our broad educational effort is that, you know, we can actually prevent it. 53% of those 12,000 cancer deaths that Jack spoke about have prevention and early detection components to them. And what we need to do, since we're the worst state in the nation for cancer, we need to build, develop, run, and fund the best cancer early detection and prevention programs around.
We are climbing through our 14 minutes. We have 5 minutes left. Do a commercial, talk to people. What kind of lifestyle can they lead to prevent colon cancer?
Well, colon cancer is a disease of aging and also a disease of family history. So the most important thing I would say to start off was know your family history. If you have first-degree relatives with colon polyps or colon cancer, know who they are and when they are. Have a frank discussion. You may need to get screened and checked earlier than 50. If you're
checked means
either, if you have a high risk, it should be colonoscopy. If you have a family history, certainly if you have symptoms, that's not really screening, but you should be evaluated regardless of your age. But if you're a normal risk individual, no family history, if you have no symptoms, then you have a choice really between non-invasive testing of the stool through a variety of tests, including some new ones that are coming out, or colonoscopy. It's really your choice, because the best test is the one that you get done.
Let's give your website and phone number for people to call you and wear you out and look online. Who's got the phone number and website?
Well, our website is the word KentuckyCancerFoundation.org. coloncancer.com. Our phone number is 859-489-9135.
In the last couple minutes, what do you want people to do right now? What do you want to tell them that they should be doing to help you all out?
Well, the first thing, we want people to be thinking about prevention and early detection and screening for colon cancer. We want them to follow great lifestyle behaviors, not smoking, right weight, all those things. But in terms of how you can help the foundation out is to do some research on what we've done. Look at our partnerships that we've developed. Understand the profound impact that, in fact, a Kentucky-based program working on a Kentucky problem with Kentucky partners and having a $2 million investment resulting in an $11 million return on investment. That is something, if you were a venture capitalist, if you had penny stocks, if you were going to the store, in any way, that is a value. So we're looking to companies, corporations, healthcare providers, that in fact, if we bring healthier people into your business and your community, you're going to not only benefit financially, but you're going to benefit because your neighbors and family are with you still.
And while colon cancer has been our initial project because there was so much momentum happening in the last decade, in rankings as we began the program, Kentucky has moved from 48th, 49th in colon cancer incidence and detection all the way into the early 20s. I mean, from 49th to 22nd is a phenomenal public health story. But colon cancer, when we began the foundation, colon cancer is not our only effort. We want to look at what we can do. Dr. Jones mentioned that 53% of those cancers are preventable, and that includes cervical and breast and the big lung cancer. And we would like to move toward trying to help any Kentuckian that would like to stop smoking to be able to be sure that they have the resources and the abilities to quit smoking if they would like. And that's the next effort of this foundation.
Some people, a lot of people look at building a resume, building a legacy for themselves, and are very much territorial on what they build. I love what you're doing. You're including everybody statewide, getting partners, building collaboration, getting both sides to work with you. You've done a great job. Thank you.
Well,
and to move us from here on a lot of bad things, move us up the ladder, all it does, it keeps us alive longer, but it makes Kentucky a better state, a more vibrant state for people that are being productive and living longer.
Well, and what I really think, it shows that we can do it. We can help solve some of our own problems, and we're happy when Washington comes and helps us. You know, we want that support, but we don't need to wait for it. We can do a lot on our own.
It has taken someone, you're right, dynamic to do this. So thank goodness you decided to come back to Lexington and to Kentucky. Thank you.
Thank you for having us tonight.
Dr. Jones, thank you. Jack, congratulations. Took you a while to get you on, but I'm glad you're on. Keep up the good work.
Paul.
Thank you.
Thank
I'm
you.
Paul Schechter. Thanks for watching. Go to their website. Great things are happening in Kentucky by Kentuckians. Good for you guys. Have a nice fall.